Okay, folks. Yesterday, I gave a presentation. It was heavy on argument, but generalized arguments from principles. It wasn't very heavy on facts. So today, I want to talk about the facts. I got a lot of feedback from that presentation. And basically what it comes down to is I need to have more data to show you. For those of you who disagree or who agree with me, there's a need for better understanding of what the impacts of our choices are going to be. So as you already know from yesterday's video, if you watched, if you don't, this is your first time seeing me, I am officially a Corona heretic. I wasn't 2 days ago. 2 days ago, I bought into everything. And then I began to realize that we're actually making a terrible mistake. So this is a plea. This is an argument. This is really an insistence. We need to stop the insanity. I actually have a podcast called Candidate Everyone, in which I'm kind of pretending to run for president. So this presentation is also how I would look at the problem if I were president. That might strike fear into your hearts, or it might be something that you would find comforting. So I would like to have you just listen to me, walk through it with me, and see why I think we should be doing things differently than we're doing them right now. Part one. Part one, the corona threat. Corona and hospitalization. So we have to figure out what the impact on hospitalization is from corona. This is not entirely obvious, but let's start off with the reported data. The reported data from many places is that about 10% of cases end up with hospitalization. I actually took the Israeli rate, which is a little higher than that, a little lower in the critical condition, a little higher in other areas, and I bumped it all up to about 15% just to be safe. Let's assume 15% hospitalization rate. The challenge is that we're only seeing the tip of the iceberg because almost every country is only testing people who have symptoms. We're not testing everybody, just those who have symptoms. In addition, the criteria for hospitalization are sometimes different. Some countries are hospitalizing people in hotels. For example, Israel is planning to use hotels to hospitalize people because while they might have less or fewer symptoms, it gives an opportunity to isolate those people more from the rest of the population. Let's go, though, with the 15% hospitalization rate, but we're only seeing the tip of the iceberg. What do we mean by the tip of the iceberg? Well, scientists, it's the word that they use in this article, find that up to 86% of coronavirus infections go undetected. In this case, it's really statisticians. I mentioned the guy by the name of Jeffrey, I think Shaman was last podcast, last presentation. And he is arguing that up to 9 out of 10 cases are not actually detected. I've heard numbers that are even higher than that, 20 or 30 cases exist for every case that we actually see. We don't really know what this number is yet, but historically, we've seen this number be very high. When pandemics spread, the initial numbers for how many people actually have the disease are very low relative to the total numbers. This is actually a very, very good thing, because while it means we can't control the epidemic, it also means that the rate of hospitalization and death goes way down as a calculation against the total number of patients. So the actual hospitalization rate is something closer to this: 1.4% moderate cases, 0.7% critical cases, and 98% mild cases. I actually have a friend who works at a nursing home, and he has told me that they've got about 1.3% of their cases are serious, and the rest of the cases that they have are mild. This is, in a nursing home, this is among older people. So we're seeing data that maybe not quite as bad as we are imagining right now. Let's assume, though, it's still got a number. There's a lot of people in this world. Let's assume that 70% of the population ends up infected. Does that little number that's actually in hospitalized condition going to be a very significant number? We have to figure that out, because without context, it means nothing. So let's say 70% are infected. We're looking at about 1.47% being hospitalized. Okay. But I don't want to just do nothing. I'm not arguing for doing nothing by any means. I want to isolate the elderly now. I want everybody who has particular illnesses, problems with breathing in particular, and people over 60, I want them to go into quarantine now. I want food, medicine, and other essentials to be provided for them. We can do sterile packaging. We can spray the packages with bleach when we deliver them. We can have every nursing home worker in the country provided with a biohazard suit for $500 million. We can train people. We can do all sorts of things to try and isolate the old from this virus. It will not be perfect. It does help that a lot of old people stay at home and don't necessarily have a lot of visitors. And so you end up with a lot of isolation that can help you isolate these older people. But nonetheless, maybe that may not be the case in Italy, but it is the case in the United States. Nonetheless, we have an opportunity to isolate the old people, and isolating the old people will significantly cut their rate of illness. Let's estimate that 25% still get sick. In France, over 50% of hospitalized people are young. This is surprising to me, but nonetheless, that's what they're seeing in the French numbers. So I think that we're going to see a hospitalization rate that will be 70% of what it is without isolating the old. We'll have the 60% of the young people. This is a high estimate based on the news reports, which are a little whiffy, plus 10% that belongs to the old people, the 25% of the 40% that they own. So what you end up with is a hospitalized population with the old isolated being lower. This is not including the people who are ill because they're almost impossible to model. So what you end up with is about 1% of the population being hospitalized. Now, if we spread coronavirus out over 3 months, which I think we could probably do, we wouldn't be discouraging the spread of the virus among the general population. We'd allow it to happen pretty quickly. We wouldn't quite be encouraging it to happen as fast as possible, but it would definitely be going on. If that's the case, then our hospitalization rate would be about 0.34% per month. And the question, of course, is that a number that is frightening or overwhelming? So we need context for that. Luckily, there is context. In the OECD, about 15% of the population is hospitalized in an annual year. Of course, the 15% is not the number of people who are hospitalized. We end up with many people hospitalized multiple times. But the number of hospital admissions is 15,000 per 100,000 people. So about 1.25% of the population is admitted monthly. And for the most part, this excludes people who aren't admitted overnight. So you're looking at a hospitalized population of about 1.25%. If we add the coronavirus hospitalization burden on top of that, on a monthly basis, the 0.34, we end up with about a 27% increase in hospitalizations. That is definitely an increase. It's definitely not a good thing. The US may or may not have the capacity, or Italy and England certainly do not have the capacity, but you're going to end up with an increase in hospitalizations of about that rate, given the isolation approach. Now, a lot of people like to talk about healthcare systems being at a breaking point. I'm not sure how you define breaking point. What you see in healthcare systems is you're unable to treat more people. You triage people, even in a military situation, which you have mass casualties or a bombing or something like that. You make decisions about who to treat that draw the line lower based on the resources you have available. Every medical person, I would imagine every nurse and doctor is trained in how to do this. You take the people who are, and there's different levels of triage, different approaches to triage. People who are beyond hope, you don't treat. People who don't need help right away, you don't treat. The people in the middle who you can help, you do treat. But of course, in every situation, beyond hope also means people who are going to require too much investment to save. And as horrible as it is to say, every healthcare system does this. You can't get a transplant. You can't get certain cancer therapies. You can't get certain medications that are too expensive if you're over a certain age in most countries, even in the United States. And in some countries, they won't even tell you if you're sick because they don't want to spend the resources treating you or the resources talking to you about your disease. They'd be happy you're letting you die and not know what condition you have. So every system does this. We would see an increase in this sort of decision making with a 27% increase in hospital admissions, but it wouldn't break the system. It would just bend it. So why is Italy so overwhelmed? I don't think Italy's broken. I think it's overwhelmed. First of all, we can see Italy has a very old population, median age of 47 versus 38 in the US and 30 in Israel. These are very normally quoted statistics. The elderly population didn't have a chance to be isolated. We can still do this. And we had very little investment in health capacity in Italy. And actually, this is the case in many other countries. There's very little investment. They have very little headroom. They're going to have to make tougher decisions. But I think the most important thing is that Italy is using biohazard protocols. So you end up with everybody gowning up. You end up with an enormous amount of additional resources in order to treat patients. I do think that we should have specialized people who are focusing only on these patients. I do think they should obviously take some infection precautions, but I don't think we necessarily need to treat them like grade 1 bio or whatever the grade is. I don't actually know. Biohazard situations. The expense is very large, and the number of younger people who are treating those will be very small, the number who actually need to be hospitalized. And so it would be best probably to treat these people outside of main hospital wards, perhaps in separate buildings that we establish, like hotels, because there's certain specialized kinds of care that they need. They don't need the full bucket of treatments, and it would be best to treat them with people who are just working on those patients. So, in my opinion, that's why Italy's been overwhelmed, and it's something that can be avoided. Okay, let's go on to the second part 2, Corona and death. How much death is Corona going to add to our society? So South Korea is the only number that's been testing large numbers of asymptomatic cases. They've tested about 1 in 200 people, or 0.5% of their population. But those tests are still skewing towards the ill because, of course, if you're ill, they're going to test you. Whereas if you're not ill, they might test you. Nonetheless, these numbers provide our closest estimates of death rates. There's caveats on both sides. Not all cases, many cases have not been resolved yet, so we don't know whether or not the death rate is going to rise. Of course, it's going to rise for the cases that haven't been resolved, but at the same time, many cases have not been detected, even in Korea. So what we're looking at in Korea is a death rate that is probably pretty representative of what we're going to get as final numbers. The death rate then broken up by age group. Now the Korean data breaks it up by 10-year groups that are on the evens, so 20 to 30, 30 to 40, 40 to 50, etc. The American data and the OECD data tend to group people by 15 to 24, 25 to 34, etc. What you normally see in marketing studies, that sort of breakdown. So what I've done in order to standardize this is I've taken the average of the 40 to 50 and the 50 to 60 becomes the 55 the 55 to 64 group to try and bring them together. All of these numbers are estimates. This is not a perfect methodology, but it gives us a pretty good ballpark figure about what's going on. So we can see here that the death rates from the different age groups, death rates for the 85-plus-year-olds, very high at 0.7% or 0.75% of the population. At least it seems very high, but of course, those people are dying at a high rate anyway. So we need to have more context. We need to understand what the death rate is anyway. So luckily, we have that data. We have death rates without corona, with baselines, and we can see that the corona adds a substantial number to the death rate of this population in particular, and it continues to add a substantial. In fact, for the 75 to 84-year-old cohort, it would raise the death rate by more than double. However, of course, many of the people who would die of corona would be dying of other things anyway, because these diseases, like any diseases, tend to affect those who have pre-existing conditions more. Hard to say what that is. I'm just going to assume it's cumulative. Nobody who dies from corona would have died from something else, and vice versa. So that's the numbers that we see there. However, that's number. In order to use that number well, what we're going to have to do is we're going to have to see the impact of corona on life expectancy. So luckily, the CDC provides, this is US numbers, the CDC provides mortality, life expectancy at different age ranges. Again, I use the middle numbers for each age range. So 25 to 34, I use 34-year-olds lives remaining. And I said, okay, if this percentage of people die in this age cohort, then they're going to lose this many years of their lives. And you end up with this figure. You end up with this amount of life lost, years of life lost. Per person. And so in the case of 75 to 84-year-olds, corona would cost about half a year of life expectancy. Okay, let's keep going down the road here. However, if we can isolate people over 60, which I think we should be doing immediately, and we have 75% success in that isolation, then that big peak really begins to be cut down. It has no impact on the 55 to 60, it has no impact on the 50 to 60-year-olds. I'm isolating at 60 years old, but it does have an impact on the higher groups. And even on the lower groups, people can do isolation to some degree if they're not working, if they're retired, whatever it happens to be. And obviously, if they're ill, we recommend it. But with selective isolation, we can see a tremendous drop in the coronavirus toll. So how does that look on life expectancy? Well, again, we can see that here. We see a drop off in the impact on life expectancy here. And what was a half a year of life lost in the prior case where there's no isolation becomes something significantly smaller. In fact, there might even be less life lost by the isolated populations than by the 55 to 64-year-old group. Okay, so My suggestion, of course, remains isolating the population, but in order to decide whether or not that's the right approach, we have to understand the impact of mass isolation, which is what's being recommended, the cost of an economic shutdown. Let's go into this. So Italy, Israel, Spain, they've sent almost everybody home. Schools are closed. Parents need to watch their children, and other countries are following their lead, including many localities in the United States, which have closed their schools. What does this mean? How long do we have to keep this up for? Well, we might stop this virus in the first world. I don't think we will, but we might be able to stop it in the first world. But in India, Latin America, Africa, much of the Arab world, it simply won't happen. There will be no way to stop the virus. So our economies are going to have to continue to have these antiviral approaches in place until there's a vaccine available, which by all accounts is a year out from now, or maybe at best 9 months, 10 months out from now. So we're talking about shutting down our economy for 9 months to a year until we can get an effective vaccine, if we're lucky, on the vaccine front. This is a terrible cost. And we might think, oh, we can just shut our borders to these other countries. But there's illegal immigration, people coming across in boats from Africa. People will come through the borders who don't test positive because they're very early stage. You're not going to end up in a situation where simply closing your borders is going to prevent any new cases. In fact, South Korea, which has been very effective in its control of the virus, has not shut its borders with any country but Japan due to a tit for tat, and with China's Hubei province. South Korea has not gone with that approach. They understand they're a trading economy. They're going to need to have their borders open in order to function. Likewise, if we have 12 months without borders open and with people in isolation, that'll be the only way to get through it and avoid having a flare-up again that will kill lots of people. So we're talking about long-term home isolation going on. What does this mean for jobs? Well, this is my estimation. I could be wrong. Let's assume essential people continue working. I'm guessing 30% of capacity will be lost, 30% of employment. In mining, construction, manufacturing, where you got to show up, we're going to get rid of a lot of people. In utilities, well, we can always delay fixing the power problems in California. It couldn't cause a wildfire. That's what we'll be doing. Long-term stuff will go away. Wholesale trade and resale trade, those will be things that will be reduced because there's not as much to buy and people aren't going to go out shopping. Your needs when you aren't in a store tend to drop. You don't have all those things drawing you in. Transportation and warehousing, you're going to see that rise. You're going to see a lot of people driving a lot of things around. Information, financial activities, professional, all that's going to drop some, simply because of overall business climate, but also because you have your kids at home. You're going to have a less opportunity to be employed. The businesses you work for are going to have a harder time. They're going to cut income of their employees. It's going to be very challenging. Educational services, I don't think there'll be any impact. Teachers are still teaching in many places. Healthcare, we'll see a rise in employment. Leisure and hospitality will be erased. Simply, there's no opportunity to use hotels. I don't think airlines are, we have transportation and warehousing. Airlines are going to get killed, and I didn't include that here, and that will have a big impact on employment. And hospitality, of course, hotels and restaurants are going to be killed. Other services, I estimated 50%. Not sure what goes in that bucket. This bucket, by the way, is from the BLS, Bureau of Labor Statistics. And then we have non-agricultural self-employed at the bottom, and I did 30% there as well. The kid impact is there. So we're looking at about a 30% impact overall. And that's assuming that we don't see mass bankruptcies of companies due to the financial constraints that they'll be facing. Ripple effects from airlines going under could be huge in terms of banking and other segments of the economy. The impact, of course, would be greatest on blue-collar and service workers. It'd be greatest on the poor in the United States. Of course, blue-collar does not mean poor if you have a union job, but in many cases, blue-collar workers are working-class poor people. 29% of Americans have less than $1,000 in savings. That won't even last 2 weeks. You're going to end up with a massive drop in available money for people, and that's going to result in homelessness and hunger, a lack of other services. It's going to be a huge problem. And of course, with that, healthcare needs will increase. I would guess healthcare needs might increase by as much as, say, 27%. So what does this do to life expectancy? Well, it's hard to model exactly what it does to life expectancy, but there was a very interesting paper put together by Columbia University's Sylvan Wachter and Chicago Federal Reserve's Daniel Sullivan, and they looked at the impact of unemployment on mortality, basically the number of years lost to people who lost their jobs. This is not looking at a broader economic collapse again. This is just focused on the 30% who lose their jobs. And if we look at this data, we will look at it on an age group basis, as we have been looking at everything else. We can see the years of life lost are pretty substantial. Of course, they drop off as you get older because the employment rate, the default employment rate, drops off as people get older. And I'm only including here a 30% unemployment rate. Who knows what it would be, but it could be very, very steep. So the impact is per person, per employed person in the economy, is about these numbers. But of course, an economic collapse will also hurt our ability to care for the sick. Why? Well, first of all, government revenues from income and sales and other taxes are going to plummet. Capital gains tax will be eliminated. This will reduce public health and hospital funding. California, for example, is funded very highly by income taxes on the very rich. Nothing wrong with that, but what's going to happen is you're going to see no income among the very rich because their income is based on, very much based on general economic success and growth of the economy. And if that's not happening, all of that tax income vanishes. And of course, if we're only doing essential industries, it becomes very hard to define essential once you get past a week or two. The hospitals require MRIs, pacemakers, catheters, IVs, medications, drugs, bleach, whatever it happens to be. Just to give an example, this is a classic example. What does it take to manufacture a pencil? Well, pencil needs all these raw materials. And then those raw materials, just take one of them. Cut wood requires a lumber yard, requires trees, chainsaws. Going on the other line, you have tooling, machining, metal processing, mining. All these areas require lots of other things to support them. And of course, every step requires transport, which is fuel, vehicle manufacture, oil processing, oil extraction. From vehicle manufacture, you go into an infinite array of different industries. So when we're trying to say essential industries, what we're really saying is we're not going to make anything new. We're just going to use the equipment we already have. Well, that works for a very short period of time. And then things begin to break down. Things need to be replaced. We need to spend money on stuff, manufacturing new stuff. Hospital bed is a hell of a lot more complex than a pencil. So there is no essential industries. Every industry ends up being essential, and our ability to provide healthcare will drop tremendously if we don't have people out working and making things. The people who can work from home tend to be the people who are designing the future. They don't tend to be the people who are making the present. In a local emergency, of course, you can buy products from unaffected areas, but this is a global emergency. So that's not an option. We're looking at a situation in which we simply can't get what we need from other places. So this is a graph that's made up, but it's an estimation. If we were to isolate the old and infirm, we'd see a little bit of a stretch of healthcare demand. We'd see it go back to where it was before. In some countries, this line is very close, and others it isn't. That's why there's no numbers. But if we shut down the economy to slow the spread of this disease, then we're going to end up with a massive drop in healthcare capacity and a massive, massive deviation between what demand is and what capacity is. And a lot of people will die when we do that. I can't model that any more precisely, so I don't have those numbers in here, because I kind of can model it a little more precisely in very gross form. And that is by looking at the death rates of countries versus their incomes. A 40% reduction in output results in 2.6 years of life lost for everybody. This is not about the 30% who lose their jobs. This is about everybody. 2.6 years of life lost per average, on average. We'll get to that later and look at that number, but it is a massive, massive impact. And of course, that's just in the first world. In the third world, 3.4 billion people live on less than $5.50 a day. A lot of them make their money due to really low-grade mining, manufacturing, farming, which ends up serving the first world. They also make their money from just going through the trash of the first world. If the first world isn't spending and consuming, you're going to end up with a lot of those people facing an existential threat. I honestly believe that tens or hundreds of millions of people would not only lose health service, which they have in very limited amounts, they would actually starve to death. This would be an untold tragedy if we were to shut down our economy in order to save ourselves. So if we dramatically slow the economy, huge numbers of lives will be lost. And again, this isn't modeling a systemic collapse of the economy due to banks and other financial aspects of the economy shutting down. This is not due to bankruptcies and all that. This is just due to a lack of labor in the market and ability to conduct trade. So what's the choice we have? First option, we have mass isolation. We can see the mass isolation, years of lives lost. Again, this is peaking out at about 0.35. If we include years of life lost with an economic collapse, we're looking at something closer to 3 years of life lost on average across the United States. That's a terrible, terrible number. If we continue on to the next segment, we have the do nothing option. Here, the life lost among the young is lower, but we do have people dying in large numbers among the old, up to a half a year of life lost in the 75 to 84-year-old case, which is quite a substantial number. And then we have the third option, which is the partial isolation. We do it now, we do it quickly, we do it completely, and we end up reducing the amount of death among that older cohort. If we compare these three options, we can see that partial isolation wins across all age groups. With mass isolation, the young suffer the most. With do nothing, the old suffer the most. And with partial isolation, we see wins across the board. Just to put that into context, this is the life years saved versus mass isolation by isolating the old, doing nothing, and of course, mass isolation itself. We're going to end up with 50% savings of life by doing nothing over mass isolation. Doing nothing, not isolating anybody, not taking any action, we're going to save an enormous number of lives. If, however, we isolate the over 60s, we're going to save half again as much. Tremendous number of lives will be saved, and this mass isolation number is very low. As discussed before, it's about 0.4 versus 2.6 additional from an economic collapse. So we'd be looking at maybe a number that is 6-8 times as high. Just massive numbers of lives will be lost if we maintain an economic shutdown for the amount of time that's required to actually control this thing. So, are there caveats to what I've said? Of course, there are lots of caveats. There are always caveats. But we have to make the choices with the best data we have. Let me go through a few of these caveats because they are relevant to us. Caveat number one, death rates could rise. Of course, death rates could rise. This might lead to isolation being a better choice, but I doubt it. They'd have to rise substantially. The bad, the effects of economic collapse would be much worse than what I've modeled here. Again, I discussed that 2.6 additional years life lost per person would be absolutely horrifying. The good, hidden case numbers could rise. They've done this in previous pandemics, and this could lead to less isolation being a better choice. We may not want to isolate the old. And also, it doesn't count isolating the ill, which would cut the death rate among the young. And of course, the best outcome, the best caveat could be that we could find an effective treatment. People have been telling me the chloroquine, I don't even know what it is, but apparently it's a malaria medication. It's been used since 1945, has been used by multiple governments outside the US with good effects. I know of at least one case in the US where it was used in an emergency for a patient who was the first patient who didn't have a known source of her illness. And she recovered very quickly, but of course, due to the lack of testing in the US, they have not been able to test her blood samples right before and right after administration to see the amount of virus that was in her blood. Nonetheless, her doctors suspect it is a very effective treatment and it should be rolled out very quickly for more people. Again, we don't know that. So why are we getting this wrong? Well, I think there's two core things. One, epidemiologists are there to stop disease. That's their job description. Their scope is too narrow. They're focused on this disease and they're missing the broader picture. They can't help it. The second thing is the public is panicking. Media and social awareness are excellent at raising awareness of a single issue. We hear about all these patients. We see all these patients. We're aware of this problem. What we're not seeing is people dying of other things. We're not seeing the effects of hunger. We're not seeing the 9 million people a year who die from hunger in the third world. And that number will increase. We're not taking that into account because, as I said in the last video, those are hidden deaths. But we need to be taking the hidden deaths into account. So what should we be doing? Share the broader focus with everybody you can. Put the cost of our choices into a broad context and fight the panic. We need to think about this. What would I do? I said I was candidate everyone, pretending you run for president. Well, if I were president of the United States, I would do what I've recommended here. I would isolate the old immediately. I might isolate the rest of the population for a week to get better numbers, but I'd isolate the old immediately. And I would follow up by opening up the rest of our economy and getting as many people working as possible and getting things flowing and working and functioning well. I think that is critical for the well-being of not only the United States and not only the rest of the first world, but also the third world. Years ago, as I said in the last podcast and the last broadcast, we discovered that if you fight a war by shutting down your economy to fight the war, you actually end up with fewer resources to fight that war. And I think that's the case here as well. Mass isolation is a terrible, terrible mistake. It will cost many, many lives. We have better options. Even not isolating anybody is a better option than what we're doing at this point. If the virus had been controlled in China, that wouldn't be the case. If the virus had been controlled upon its initial entry in the United States or other countries, that wouldn't be the case. But that's not what we're looking at. This is a pandemic, and our choices have got to change, and our decision-making has got to get a whole lot better. We're just going to be throwing lives, well-being, and prosperity right down the toilet. Thank you for watching, and please spread this information.